In Victoria's nursing homes, a third of all coronavirus deaths in Australia being aged care residents. The largest outbreak is at St Basil's in Fawkner. Nick Barbusis lost his dad Paul to the virus and believes his death was preventable. And Nick joins us now from Thornbury in Victoria. Nick, thank you so much for your time this morning. Can we say we're so sorry to hear of your dad's passing? How are you and the family holding up?
Thank you, Ali, for that. Thank you for your kind words. We're okay. We're struggling a little bit in terms of what has transpired the last 48 to 72 hours. It's been a bit of a blur, to be honest with you. We were in a situation where we thought that our dad was out of harm's way, that it was isolated in an area of the home that was away from where the actual outbreak was. Unfortunately, that wasn't to be the case, and he passed away yesterday around midday.
I mean, we can hear the emotion in your voice right now, Nick. I mean, to lose your dad, but to lose your dad in these circumstances. Just talk us through what happened over the past 72 hours, because we know at one point you were told your dad was fine in his room when in fact he was in hospital. Just talk us through what's happened over the past couple of days.
Yes. So if I go back probably over 7 days ago when he had his first COVID test, and at the time it was deemed to be negative. Post that, because apparently there was some issue with the testing regime, the residents were retested a couple of days later. At the time, his sample came out to be inconclusive. We were told that the actual outbreak was in a dementia unit, which was in a separate wing of the facility. So everyone that didn't have the COVID and was in the mild to low care area was relatively safe, and these people were consequently locked into their room for their own protection. Post that, we've been, had repeated attempts to get information out of the home. It's been extremely difficult. The information's either not been there or, as it turns out, probably incorrect. We were given a FaceTime number to use to talk to our relatives. Repeated calls via FaceTime were ignored. When I finally got through one of the days, I was told that they were too busy to put me through to my dad. As it turns out, the government appointed people came through on the Wednesday of last week, gave us a bit of hope that we'll be able to get some good feedback and good information. Someone from that area, the communication team, contacted me on Friday, telling me that from now on there'll be a daily call, and on that daily call there'll be an update on my dad. I was told at that time that my dad was in his room, that he was comfortable and away from where all the chaos was. If we move forward into 24 hours, which was on the Saturday around 2 o'clock, I got the same call from the same lady, basically telling me that my dad's condition hadn't changed, basically intimating that he was still in his room and okay. I was flabbergasted, to put it mildly, when I heard that, because I had a phone call 6 hours earlier from the hospital that he was in, Northern Hospital, telling me that he's fighting for his life. And the chances of him seeing the next 24 hours to 48 hours were very, very small. Probably, non-existent, to be honest with you. So
Nick, were you or anyone in your family able to be with him when he passed?
The night prior to him passing, we were lucky enough to have a FaceTime call with him. The nurse that helped us with the FaceTime was great. We saw a smile on Dad's face when he saw us, and especially his grandkids. And it was comforting for us to be able to see him, albeit in a pretty bad way.
Well, Nick, we're about to speak with the Minister for Aged Care, Richard Colbeck. Do you have a message for him?
I'm not sure what to say, to be honest with you. I'm just hoping that the people that are in there at the moment are helping the residents. There are a lot of vulnerable people in there. There are a lot of relatives that are anxious about their relatives, the people that are in there. They need to know the truth. They need to know what's happening, even how bad that might be. The killer for all of us is the waiting game, the lack of information. Hopefully that's changed. I'm hoping that will change. I didn't see a change in the 24 hours that I sort of experienced that. I guess, Ali, one last comment. I'm not sure if you're going to go to the Minister now, but can I make a plea for everyone to listen to the Premier, to the Chief Health Officer, put on their masks. A lot of people that are currently active are between the ages of 20 and 40. You're not invincible, and if you think you are invincible, please think of your grandparents, your parents, your co-workers, the lady in front of you in the checkout at the local supermarket, and before you take that first step out of your front door, put on your mask.
Nick, really well said. Mate, thank you so much for joining us. As I said, we're thinking of you and your family this morning. We appreciate it. Take care of yourself. Carl.